This is the suboccipital routine. Again, we're still in the supine position. This one has a different type of treatment. Again, this one is going to be the most prevalent during CAD, cervical acceleration, deceleration, which is the technical term for whiplash, is CAD. We discussed that during class, the momentum or the inertia that pushes the head forward and then snatches it back. So it's not the forward momentum, but it's the snatch, the recoil that makes those muscles then contract. And that's why they get tremendous amounts of pain in the suboccipital region. And so the routine is going to be covering, again, the base of the occiput and the suboccipital muscles, to which you have 6. So you have them going on two sets, and transverse processes, again, landmark, jugular vein, carotid artery, all of those are still going to be the same landmarks, as well as another structure that we focus on behind the back of the ear, and that's the styloid process. People may have a condition called eagle talon syndrome, where the styloid process is excessively long. And so doing this treatment as you're doing friction from lateral to medial, medial to lateral, you could actually push tissue into the styloid process. So there's a new one that's added to the group, and that's going to be the styloid. Anytime you get close to the ear, you have to keep in consideration your styloid process of your client, okay? So again, a simple routine. You find the posterior, you're going to find the occiput. Find your landmark with the cervical spine, with the spinous processes, occiput, transverse processes on the lateral side. So this routine has you bring your fingers up and curl them towards yourself, right underneath the hook of the occiput. We can have the head in a slightly elevated, with the chin slightly elevated towards the ceiling. Remember, if you shorten the angle for the muscles that you're treating, it'll be softer and easier for you to engage. So again, I'm curling my fingers in. Be conscientious not to jab them and stab up into their occiput. Generally, people who are having these types of conditions that we mentioned are in a lot of pain, and it is very hypersensitive. So be conscientious. Lighter is always better. Less is better than more in this condition. All right? So curled fingers towards yourself, right? And in friction, the entire region, right? Suboccipital. Remember, we said be conscientious of the styloid process. So I could actually keep my index finger at the styloid. You don't have to. It's not part of the routine. But to help you to understand where the landmark is, I have my index finger there, and then I'm frictioning with my other 3 fingers. If you don't want to do that, and you're conscious of where you are and that they don't have a extended styloid, then you can use all 4 and just do medial to lateral friction. So this is an ipsilateral routine, so you're only going to treat one side at a time. I don't want you trying to use both hands doing this and rocking their head. I want you to just do one side at a time. So on the left side, I do the same. I'd curl my fingers in towards me. I would do 1 medial to lateral friction. And step 3 would be make sure that you're frictioning between C1 and C2. So the uppermost 2 vertebrae. C1, C2, lateral and medial friction. Now, if you want to get even closer, then you have to make sure that you move the SCM a little bit out of the way, and behind there, you will be able to hit the mastoid process. You'll feel that right off the bump, the attachment for the SCM. Also will be the digastric muscle and longissima are all in that same region. So those deeper cervical muscles, which are really affected during a whiplash, cervical acceleration, deceleration. So remember that CAD, okay? And that would be a very simple routine for suboccipitals.